this is Dr. Usama Jamil. I have done my MBBS from Pakistan and I have also done my master's in public health. And currently, I am doing my residency in general surgery. Today, we're going to discuss that very serious topic. It is called CPR. So, it is not just a lecture or a presentation, it's more life-saving skill. Okay, can you all hear me?
Yes, we can hear you.
All right. So, what is CPR? A CPR is uh, a cardiopulmonary resuscitation. All right. It is an emergency life-saving technique performed when someone's heart has stopped beating or it's not effectively pumping blood. Okay. Let's simplify it. CPR is cardiopulmonary resuscitation on a person who suffered an episode of heart attack or heart failure or cardiac arrest. These all are synonymous terms in some ways. So let's delve deep into it. It combines chest compressions and rescue breaths to maintain blood circulation and oxygenation until the professional medical help arrives. Okay, if a person faints suddenly and he seems not to be breathing, or he's having chest pain, he's suffocating or really trying hard to breathe, but he's really struggling with his breath and all, and he's shouting with my that my chest hurts, and he's also saying I can't breathe. So this can be indication of heart attack. Okay, so what do we do in the CPR? We do chest compressions, number one, and then we do rescue breath. It usually, if a bystander gives CPR, he has to chest compressions first, then give mouth to mouth breathing. Okay, so there is the proper interval. You have to give chest compressions, then you will see either his or her heart is beating, then you have to give some mouth to mouth breathing to push some air into his lungs so that they can breathe. Meanwhile, his heart is not functioning properly or stopped for a while. So that's why we do CPR. All right. Uh, so moving to the next slide, why is CPR done? Okay, why is CPR done? It it's simple explanation is CPR is done to save someone's life. If medical aid is away, if the hospital is away, if you do not have medical aid at hand, so instead of being a bystander to that person who is suffering a heart attack or heart failure, you can do CPR on that person. You can save his life. You can save his uh, long complications that can occur after the heart attack. Like some patients suffer brain injury due to decreased oxygenation or decreased blood flow to the brain. So they suffer permanent damage if the CPR gets delayed or medical aid is delayed. So the primary goal is to sustain blood circulation and oxygenate vital tissues until advanced medical aid arrives. Okay, our main and primary goal is to uh, you know sustain blood circulation. When the heart stops beating, there is no blood flow in the body. uh, our brain, our kidneys, our stomach, our lungs, they start starving. Like if blood doesn't reach that organ, they start dying. Some organs may even undergo serious ischemic injuries. Ischemia is reduced blood supply to that organ. Some organs stay for a few minutes, but some organs like brain, they can only uh, can stay without oxygen or without blood for a little while. They start getting dead, their cells getting dead. So see, our main goal is, number one is to save someone's life. Number two, to avoid potential complications that can occur after someone, if someone suffers heart attack. So it is an immediate response crucial for enhancing survival chances. Okay, if the person gets CPR done immediately, there is high chances that his life can be spared or saved. And if he lives, his complications, like as I said before, that his brain damage can be reduced, his injury to the lungs or other organs like kidneys, if there is reduced blood supply due to heart failure or due to any other reason. So the kidneys also suffer a great damage. They stop working, like so. There is no, it's all once it's this cycle is started, like it goes on in the form of synchronization. Like one organ shuts off in response, another one shuts down, and other shuts down. So it starts like the whole body of the person gets shut down. Okay, so CPR combines chest compressions and rescue breaths, stimulating the heart, pumping to maintain brain oxygenation. So if I would have to choose, like to save one single organ by doing CPR, that would be the brain, because the brain controls our breathing, our circulation, like the way our heart beats, the way we respire, like we let air in, let air out, the way our heart beats to circulate blood in our body. That this is all controlled by our brain. So if a person is suffering from heart attack, my first priority will be to save his brain tissue from dying by doing CPR. So if that person's heart is not working for a few minutes, if you give CPR on him, you do chest compressions and give mouth breathing, then the supply can be restored transiently to the brain, so the brain can maintain working. Meanwhile, the heart gets repaired, or the patient gets proper medical aid. So it is simple and effective, empowering anyone to become a potential lifesaver, significantly boosting positive outcomes in the crisis. So learning CPR is not just an ordinary skill; it is a life-saving skill. Anyone can learn CPR. Uh, if the medical aid is away, if the hospital is away, if there is not no one trained professional, medical professional is available at hand, and like your family member or any friend is suffering from this condition, like first one, you have to call 911 or any other rescue uh, helpline. to you have to do that first, then you, like if you have to wait like 10 minutes or 5 minutes, the aid is away. So you don't have even seconds to wait, you just have to start CPR. So there are proper ways you can do CPR on someone, like to be if there is sometimes if a person do CPR, but if he doesn't know how to do it, like if we ever saw in movies or something, like he's just doing chest compressions, not even properly, not giving adequate uh, you know uh, time for lungs to expand and collapse. So that is not a proper and effective way. So our first motive should be to do a CPR if the medical is it is away. The second one is to do CPR effectively. So if we are doing, if we are putting some effort, like it have to show some result. Okay, you have to do it in an effective way, in a good way. So there are two conditions, like number one is CPR in myocardial infarction, commonly known as heart attack. Number two is CPR in heart failure. So if I say like in a very common term like CPR in heart attack, in which a person's heart is normally beating, a person is healthy, and suddenly his heart stops functioning, that would be called heart attack. Well, in CPR in heart failure is definitely another thing, like a person is already having something like a heart disease, or if he previously suffered from heart attack or any disease related to cardiovascular system. So uh, CPR in that condition would be called CPR in heart failure. So these are two different terms like heart attack and heart failure. Heart attack seems like to be stopping of heart in a normal healthy person. Meanwhile, heart failure would refer to like a person is already suffering from any disease related to heart or cardiovascular system. So in that condition, that would be called heart failure. So myocardial infarction, commonly known as heart attack, occurs when blood flow to the part of the heart is obstructed. Okay, if a person is healthy doing his normal routine work and everything is going smoothly, if anything gets stuck in the blood vessel that supplies the heart, that blood flow will be obstructed to the heart. It hurts itself. Then heart gets starting shut down. It will be starting like to appear in the form of symptoms like chest pain, shortness of breath, like sweating, and pain radiating to the left arm, to the left jaw. These are common symptoms that a person is having a heart attack. He or she may show all the symptoms or may one of these symptoms. All right. So this blockage leads to damage or the death of muscle tissue. Once that blood vessel gets blocked and it is not cured, if it is not cured for a given period of time, then that area which gets deprived of the blood will die like permanently. All right. CPR maintains blood circulation, ensuring oxygen supply to critical organs. Prompt CPR during MI can significantly enhance survival chances and reduce potential complications. Like if a person has heart attack, blood flow to it heart walls gets reduced or obstructed. The heart stop beating for a while. If you do CPR on that person, like you do manual chest compressions, like you are already squeezing the heart in and out, that heart like its mechanical work is restored to somehow normal, not normal, almost normal. That if heart on the chest compression, if you do chest compression, you squeeze the heart in and out. This way the blood circulation resumes, uh, unless or until it is properly cured or medical aid arrives. All right. So next CPR is in the heart failure. Previously we read that CPR in myocardial infarction or sudden heart attack. Next one is if a person is already heart patient and he or she suffered CPR in the heart failure, it would be called congestive heart failure. It is more accurately described as weakening of the heart in which heart function is already compromised and heart is not strong enough to pump blood. So this will result in a gradual heart failure in that patient. During heart failure, the heart is not functioning normally, limiting its ability to pump blood, and the oxygen and nutrients include throughout the body. Okay, if the person is suffering from heart failure, it is a chronic condition. That person is suffering from heart disease, heart failure. So that person may already have like symptoms in different organs as well. He or she cannot, like that patient cannot walk properly. She gets tired, she gets breathless. She is already looking sick, or she has reduced weight. Like in this, these are manifestations in which heart failure can be manifest itself. I will answer the questions at the end of the lecture. So please keep them, must remember them or type in the chat. Okay, with the malnourished cells throughout the body, heart failure leads to the health complications such as fatigue, shortness of breath, and difficulty maintaining a regular lifestyle. If a person is already suffering from heart failure, that person, his whole body is malnourished because heart is not effectively pumping the blood to the whole body. So there will be overall symptoms like fatigue, shortness of breath, difficulty in like doing very basic life chores. So while CPR is not a primary treatment for heart failure, it becomes crucial if cardiac arrest transpired. So if a person suffering already from from heart failure, uh, if his her or heart stops beating, So if you do CPR on that person as well, if even if the heart is already in the failing stage, you can restore their heart's ability to some extent by doing CPR. So it is beneficial in both, like in heart attack or sudden cardiac arrest, or in the heart failure, or already previous, heart attack patients. So number of deaths for the 10 leading causes in the US. It is the study carried in 2017, which showed that the maximum number of deaths was due to heart disease. Number two was the cancer, then unintentional injuries such as traumas or accidents, then chronic liver or renal diseases, then stroke, Alzheimer's disease, followed by diabetes, influenza and pneumonia, kidney disease, suicide. So heart disease is the very leading cause of the death, followed by the cancer. So it is very important and crucial to learn about to learn this life-saving skill, like from this kind of to save someone from this kind of situation. So morbidity and mortality benefits. Morbidity means like the extent of the disease, and mortality means death due to that specific disease. So if we do CPR, we save the person from a prolonged morbidity and mortality as well. If he can be saved. So if you do CPR on a person immediately, like with effective way, you not only reduce its morbidity, you also reduce its chances to die. You can literally save someone's life by doing CPR if they are having heart attack. So CPR offers substantial mortality and morbidity benefits. In terms of mortality, CPR performed promptly can prevent irreversible brain damage and organ failure, significantly increasing the chances of survival during cardiac emergencies. All right. From a morbidity perspective, CPR minimizes the risk of long-term neurological impairment in survivors, improving their overall quality of life. So if a person, gets CPR but is late, uh, his brain already suffered some episode of reduced blood supply. That part of the brain will stop, working. Like they can get paralyzed, they get some dementia, or they get some other sort of brain disease like neurological symptoms. So in by doing the CPR in time and effectively, morbidity and mortality both can be reduced overall. So this is a graph shows that survival rate versus collapse shock time. So there these are survival rates showed when bystanders gave CPR, and these red lines shows when bystander CPR. So if a bystander gives CPR in time, that shows there is high chance of that person to survive. Okay. Then there comes a red line, non-bystander CPR. It means bystanders couldn't give CPR or give it properly. Then medical aid arrived, uh, or someone else came from far and then gave the CPR, but it was late enough. The patient might have less chances to survive, or may have high chances to develop a morbidity if they live or if they survive. All right. So how to do a CPR? Number one is danger. Like check for hazards surrounding the scene, ensure the safety of yourself and the person requiring the first aid. So first we have to quickly assess that situation, that person needs help, and you or people around are sufficiently near to assess that patient or that person, that he's not accompanied or he's not getting any help. Like, so you have to assess the situation, you have to assess the environment, then you have to check for the response. You should like poke him. Hello, are you okay? Are you doing well? Are you breathing? Do you need anything? Do you need help? You try to get any response from that person. If that person collapses or faints in front of you, so if the person is unresponsive, you send for help, like call 911. So first you call the professional medical aid for that person. Then you start the CPR, like to reduce the morbidity and mortality chances by doing CPR. Meanwhile, the medical aid is on the way. So first you have to, maintain the airway. So if a person lies straight, his, mouth is like this. So let me show this way. So this is a patient lying, this one. So it's for example, its lungs are here, then it goes here, then it makes an arc here. So if uh, you have want to open the airway of that person, you have to, lift its jaw, his or her jaw like this. Then the airway like most likely to become this way straight. So if you do not do this, the airway will be like from the lungs like this way up. So if you do this, the airway like most likely get straightened a bit to let more air in. Then you check for breathing. If the person is not breathing or showing any signs of abnormal breathing, like he or she breathes for a minute and start breathing, let and breathe again, like not if they're not normally breathing, or if they are not breathing at all. So you start CPR immediately. Give 30 chest compressions followed by two breaths. You have to make hands like this, and you have to put the hands like on the patient in that middle of the chest bone, and you begin chest compression, stronger enough to squeeze a little bit. Okay. Then you have to give 30 chest compressions followed by two mouth breathe. You do like this 30 compressions, then you give mouth two breaths, then you again start this cycle of 30 compression that followed by two breaths. So repeat until the ambulance or any medical aid arrives. So they will, if the person is not, if the person doesn't get conscious by doing the CPR, so that in meanwhile the help arrives, they will do further CPR or do defibrillation by, uh, putting the electrodes like to heart to start beating again. So that's the part where the medical professionals get deployed. But before that, meanwhile, calling for the help and arriving the medical professionals. So there is a between time for waiting, like for the professionals. So in the meanwhile, you can do the CPR on the patient to save it. So before you begin, before starting CPR, check if the environment safe for the person. Is the person conscious or unconscious? If the person appears unconscious, tap or shake their shoulder and ask loudly, "Are you okay?" If the person doesn't respond and you are with another person who can help, have one person call 911 or local emergency number and get the AED if one is available. Have the other person begin the CPR. Okay. If you're alone and have immediate access to telephone, call 911 or local emergency number before beginning CPR. Okay. Get the AED if one is available. AED is more like, help, medical help, yeah, or kit, or artificial breathing like ambu bag, etc. That includes, as soon as the AED were available, deliver one shock if instructed by the device, then begin CPR. So AED is proper and equipment or gadget, like it contains gadget. If you are not medical professional and you doesn't have AED, you can do CPR without AED. Okay. If AED is available and the medical professional is near, so you can bring them to near your patient at AED and ask them to deliver by shock machine or either by doing CPR. So this part, AED and delivering the shock is main duty of the medical professional, but you can do CPR without this shock thing or anything there, that leave that part to the medical professionals. So remember to spell CAB, CAB. The American Heart Association uses the letter CAB to help people remember the order to perform steps of the CPR. So CAB, CAB, compressions, airway, breathing. Okay. So do 30 compressions as I said before. Then it corrects its airway, like doing this their jaw like this way up. Then give mouth to mouth breathing. Okay. Then start again, do it again and again until the medical help arrives. So compression push hard and fast on the center of the victim's chest, then airway like this, the jaws goes up and you give mouth-to-mouth breathing. Tilt the victim's head back and then lift the chin to open the airway. Breathing, give mouth-to-mouth rescue breaths. So first step of the CPR is to do compression. Then we have to maintain an airway. Then we have to give breathing mouth to mouth. So first of all, compression, it is to restore the blood flow. So compression means you use your hands to push down hard and fast in specific way on person's chest. Compressions are the most important step in the CPR. So follow these steps for performing CPR compression. So listen carefully. Number one step is put the person on their back on firm surface, like flat surface on the floor or on the straight desk, something on a straight surface. Okay, firm surface. Kneel next to the person's neck and shoulders like this. Then place the lower palm of your hand over the center of the person's chest like this, between the nipples. If the if the patient is female, you have to assess the center of the chest. Then you can put your hand over directly the bit of the chest bone. Place your other hand on the top of the first one, this one. Keep your elbows straight like this. Do not bend this part, your elbows. Place your shoulders directly above your hand. Like you have to do this like this is her hands. This is a straight elbow. This is a shoulder like this 90 with the angle of 90 straight. So push straight down on the chest at least 2 inches, 2 centimeter, but no more than 2.4 inches. Like if you do chest compression, like squeeze properly at least 2 inches down to the patient's chest, then lift. Do not, you know, compressed more than 2 inches, it is not safe. The ribs can break down. Okay, so 2.4 inches is the maximum safe compression space, or that would say at least, but you should compress at least 2 inches to enough to be effective to squeeze the heart to resume the circulation. Use your entire body weight, not just your arms when doing compressions. If you do this like this way, you are putting your whole this torso's weight on your hands, and this way compressions can be more effective and helpful for the person. Push hard at the rate of 10 to 100 to 120 compressions a minute. The American Association suggests performing compressions to the beat of song Staying Alive. Allow the chest to spring back after each push. You have to give 100 to 120 compressions a minute, but between each compression, you allow chest to bounce back a little bit, like to allow a little air in from the lung from the patient's mouth or the nose, so the heart gets adequate time to refill itself and then empty again, refill itself, empty again. So you have to give even seconds or milliseconds between each compression to the heart properly fill. Okay, in adults, we give compressions by this way using two hands. In child, we can use one hand. In infants, we can use two fingers. So in adults, we press down 2 inches. In child, we press down also 2 inches, but with single hand like this. But in infants, we use two fingers, but we put 1.2 1.5 inches down, like compress to 1.5 inches deep. This is the video. Please watch and listen it carefully. So this was a demonstration to how give proper chest compression. The next step is open the airway like this. Tilt the patient's head like backwards and put the chin upward, yeah, or upward, so that airway gets like straight a bit, this starting from the lungs like this. If the person's head is here, then the airway goes like thi- this. So we straighten the airway a bit to let more air in this way. So put your palm on the person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin up forwardly to open the airway like this. The very last and third step is breathing. Breathe for the person. Like you breathe for that person, or you give breath to the person by mouth to mouth. So rescue breathing can be mouth to mouth breathing or mouth to nose breathing if mouth is seriously injured or can't be opened. This step might seem like a little bit, uncomfortable, or sometimes, if you are not comfortable doing it, but just think it that way, that you are going to save a life. So you can, just put that awkward feeling up on a side, like you have to behave responsibly, and you can, just save someone, right? That person, is if you save someone, their life debt, stays forever. Like they are forever in debt to you for saving their life. So be someone more powerful than being, being weak for a moment or something. So you should give, you shouldn't hesitate to give rescue breathing if the person seriously needs it, even if after a trauma or an accident. If the mouth is injured, you can give mouth to nose breathing as well. So current recommendations suggest performing rescue breathing using a bag mask device with a high efficiency particulate air filter HEPA. Mostly these bag mask device, we also call it ambu bag. It is not available at hand, so you can, the only option you have is to give rescue breathing by mouth. So if the device is available, we call it ambu bag. Like there is a piece we start, like it has a mouthpiece, like we put it on patient's mouth, and there is a bag attached which, like, we squeeze it like this, and the air goes in instead of the manual mouth to mouth breathing or the rescue breathing. So after opening the airway using the head tilt and shift chin lift maneuver, pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. So if you are going to do, rescue breathing, you should squeeze the patient's nostrils, and you should seal your, lips with that patient's lips. So the air doesn't leak out. The air you push in straight goes to the patient's lungs, and it comes back. So whenever, if you are doing, mouth nose, you should, put to a hand or anything. If the patient's face is damaged, or if you cannot give a mouth to mouth breathing, you can give it mouth to nose. But if you are giving mouth to mouth breathing or a rescue breathing, you should, squeeze the nostrils shut, and then you can give mouth to breathing, so that, so any air doesn't leak to the nostrils, like from this way to this way. So all the air you push will go into the patient's lungs, so the person gets benefit of it. And meanwhile doing the CPR, you are doing, you are, mechanically pumping the making the heart to pump blood. You are giving patients breaths, or air goes in and out. You are sort of being a manual ventilator, I would say. So you are saving someone's life by this way. Prepare the two rescue breaths. Give the first rescue breath lasting 1 second and watch to see if the chest rises. Okay, if prepare to give the two breaths between 30 compressions. So if you give first breath to the patient and the patient chest rises, that's okay. If it does not, okay. If the chest rises, give a second breath. If the chest doesn't rise, repeat the head tilt, chin lift maneuver, and then give a second breath. So if you are not, if you haven't already did this, tilting part of the patient's head, then if you give first breath by this way, and the patient just goes like up, that's normal. That's okay. You can give another breath. But if the person just doesn't rise by the first breath, you can tilt his head like this. So the if you give more, if you give a second breath, the more air goes in, then there is more chance that person just can inflate like this. So our main purpose is to inflate and deflate the patient's chest so that he gets adequate air supply or oxygen supply by this way. So 30 chest compressions followed by two rescue breaths is considered one cycle. Be careful not to provide too many breaths or to breathe with too much force. Okay. Continue chest compression to restore blood flow. Continue CPR until there are signs of movement or emergency medical personnel take over. So this is two breaths each time about 1 second apart. So rescue breaths are like this. So if meanwhile you are doing the rescue breaths, you see the chest rising on your breath whenever you give your first breath. If the chest rises, that's okay. That's good. That's a good sign actually. If the chest doesn't rise, you tilt patient, face forward and like this, the airway gets straightened, and then you give another breath so the patient allows more air to go in. So pinch the patient's nostril shut and watch for the chest rising. So I already told that pinch nostril shut to not let air to not leak the air from the nose if you push from the mouth. So there is one last video demonstration for this hands only CPR. The audio is not working. I guess you can just follow the subtitles and video demonstration. So she is placing hands properly on the patient's chest. She says that the patient depth should be 2 to 5 centimeters or minimum 2 inches, and do compression like this. Push the hand hard and fast, and squeeze it up to just at least in the adult patient. So this was the demonstration of how CPR works and how to do CPR properly.